Welcome back. Today we're talking about the importance of preventing and treating diabetes, but not everyone may understand what's happening in the body. Essentia Health endocrinologist Dr. Bruce Henson joins us now. And Dr. Henson, would you explain the difference between type 1 and type 2 diabetes?
Sure. Both forms of diabetes are characterized by elevated blood sugar levels. Type 1 diabetes occurs because the body loses its ability to produce the insulin necessary to regulate blood sugar levels, whereas type 2 occurs when the body requires more and more insulin to accomplish blood sugar control, a condition we call insulin resistance. So you can think of type 1 as insulin deficiency and type 2 as insulin resistance.
Do we know what causes type 1 diabetes?
Type 1 diabetes occurs when the immune system attacks and damages the cells in the pancreas that make insulin, what we call an autoimmune disorder. In these conditions, the immune system recognizes a body tissue or treats a body tissue as foreign and begins to attack it and reject it, almost analogous to a transplant. So in the case of type 1 diabetes, the immune system attacks and progressively damages and destroys the insulin-producing cells in the pancreas.
Okay, we're going to talk more about this in just a moment, but first, a diagnosis of type 1 diabetes can be a big shock for a family, but with the support of Essentia Health's diabetes services, families can get the guidance they need. Kim Kaiser introduces us to a boy who's thriving thanks to careful monitoring.
To watch 7-year-old Tristan Leusman play with his friend, you'd never know he has a chronic health condition, one that he must carefully manage every day.
Can I give the camera a close-up?
That's the insulin pump he wears to treat his type 1 diabetes, and he's not shy talking about it.
As you can see, I have a favorite finger to poke.
Tristan was diagnosed in kindergarten when he was 5 years old. And out of the blue, he started needing to use the bathroom more and drink more. So we brought him to his pediatrician to do some lab work, and that's how he was diagnosed.
The diagnosis has meant big adjustments for his family, like checking his blood glucose levels 6 to 9 times a day. Because his pancreas does not produce insulin, he needs to carefully track his carbohydrate intake and receive the correct amount of insulin from his pump.
Boop. 153. Well, just carb counting, like, let's say a grilled shrimp is 25 carbs. Wait, just 20, and so we know and you have 2 shrimp, and we know 20 times 2 is 40. That's 40 carbs. You eat the whole thing, and that's how much it is.
I always tell these kids they're very brave in what they do, and they do really well. It's just amazing at how well they adapt to their disease process and able to take care of it. But there's a lot of work involved, and they have to count, you know, all the carbohydrates they eat to figure out how much insulin to take. And these kids just get so great at it. They do an awesome job.
Lisa Thomas is a diabetes educator with Essentia Health's Diabetes Services in Duluth. She works with families like Tristan's to help them make the lifestyle changes necessary to be healthy.
So we have pediatric clinic here at Essentia Health Duluth Clinic, and where we have a team approach to diabetes care, where we have an RN, RD, a physician, or nurse practitioner. We have behavioral health, and we have the child life specialists all working with that child with a chronic disease.
That support and guidance has meant a lot to Tristan's parents, Annie and Jeff.
Anyone who initially gets this diagnosis, you will be scared. That's what's going to happen. But then, you know, there are so many people who have this diagnosis. There are so many good resources within this community, both from the Diabetes Center, but also from other support groups, other parents who have it, that getting connected with something like that makes it totally manageable and doable. It just is. And you'll work through it, and you'll figure it out.
Now, they're used to a new normal.
Tristan is an extremely active boy, and he participates in weekly karate lessons and swimming lessons and loves to play with his friends, and there's nothing he's not able to do because of his diabetes.
Here's how Tristan describes it.
At first, I pretty much think it's kind of startling till you have it for a year or two, and then it just, whoa.
Giving him more time to focus on having fun with his friend. For Healthy Living, I'm Kim Kaiser.
What a remarkable young man.
Isn't that amazing?
And is that typical for the way that young people are managing their diabetes?
I think young kids adapt to this really well. You know, they don't have a lot of the preconceived notions that adults have, and they take on the challenge and do a great job with it.
What are some of the options that are available for patients?
Well, the goal in treating type 1 diabetes is to replace insulin in the fashion that the body used to provide it. So when we eat food, we get surges of insulin, or what we call bolus therapy, and then between meals and during sleeping hours, we get insulin in a slower but continuous fashion, what we call basal therapy. So there are ways now to provide that, as you saw with Tristan's insulin pump or insulin injection devices, meters that enable patients to monitor blood sugar levels frequently and simply, and even sensors that monitor blood sugars continuously to allow patients to provide insulin in a fashion that mimics the physiologic insulin secretion that they used to get from their pancreas.
So the technology has come a long way.
It's dramatic. It's kind of like cell phone technology, you know, smaller, smarter, faster.
So is it so important, why is it so important, I should say, that to properly manage this condition every day?
Yeah. Sugar is our body's fuel, and without proper sugar delivery to the cells in the body, we don't have normal energy metabolism. It's like having a bad carburetor in your car engine. Things just don't run right. And in the long term, those high blood sugar levels begin to exert toxic effects on sensitive body systems, eyes and kidneys, nerves, blood vessels. So in the long run, regulating blood sugar levels helps maintain good health.
Now, there's a lot of people, in some cases, they don't notice any symptoms, but yet they may have diabetes, and so it's a ticking time bomb if they aren't diagnosed?
Type 1 diabetes generally comes on more abruptly. When the pancreas finally loses enough insulin secretory capacity, the blood sugar levels rise abruptly, and those patients usually develop symptoms, as Tristan's mother pointed out. It's the type 2 patients who have slowly rising blood sugar levels, often without a lot of associated symptoms, and they are at risk for unrecognized complications because they don't know they have a problem.
Now, during Tristan's story, we saw basically a team approach to his diabetes. Is that typical?
Yeah, that's very important because diabetes, more than any other chronic disease, puts a large measure of responsibility on the patient. And in order to empower patients to manage their disease independently requires a lot of information, a lot of education. So having a team approach where physicians can help patients design proper insulin replacement therapy, nurses like Lisa to help patients learn to use these devices and manage day-to-day problems, dietitians to develop individualized meal plans to account for patients' schedules and activities, and counselors to help patients deal with the psychological and social issues, really enables a patient to manage what can be a difficult challenge and yet achieve really normal, healthy life.
And that's the bottom line.
Exactly.
How do you encourage patients who can feel that management is a pretty daunting task?
Well, it is a big challenge, and although we're better at replacing insulin therapy than we used to be, it still isn't as good as the original equipment. So I try and point out to patients the tremendous strides we've made, even in just the last decade, in terms of better delivery devices, better monitoring, and point out that we can now come close to achieving that goal of near normal blood sugar levels, and I think patients have a good outlook to be able to live a full, healthy life.
All right. Thank you very much, Doctor.
Thank
we
you.
appreciate you being here.